Hello, my name is Abi Dalal. It is really nice to be here with you today. I'm here to discuss what we call the Buddhist model of Suchi mobile clinics work to address vision health disparities in the greater Los Angeles area through our community clinical partnerships. I am a medical volunteer with the organization, and it was with great pride and pleasure that I am sharing this presentation here with you today. And our organization was started by the Buddhist monk Cheng Yin, a demure woman who saw the inequalities in her community and wanted to address them. She organized a small group of housewives, and they started to recycle the recycle plasticware to fund relief efforts. And now these started really hyper local, but now these are uh, across the entire globe, from helping families roused by a typhoon in the Philippines to providing patient protective equipment to hospitals nationwide. Our patient care philosophy is heavily influenced by our Buddhist practice, and that helps us to best provide compassionate care to all and spearhead health equity. Our mobile clinic, right here, as you can see, partners with local service organizations like homeless shelters and mental health clinics. And this provides a window into the vision health needs of socially marginalized and highly vulnerable communities. I'm really grateful that I'm able to give back to these communities, especially because I've learned how important this is. Vision health disparities is understudied, underestimated. It can greatly impact your life, and there's not much known about it. It's important that we address this topic, especially because, you know, of the rise in diabetes, the obesity epidemic, and the uneven spread and effects of these correlated conditions along racial lines means that region health disparities is going to be a growing concern in the coming years. I wanted to understand the health disparity factors. So I collected patient histories and I conducted qualitative research on this. I want to give you a brief overview of what this means. I read the patient histories line by line to understand the health disparity factors and themes that were emerging. And I organized all the patient histories under several categories in order to best make sense of this. From analyzing the relationship within the codes and between the codes, I created integrative theory to best examine and for us to best address vision health disparities. So here you can see a visualization of my theory. You know, there's a combination of poverty, poor eye health, and lack of eye health resource and knowledge, which each one of these is a challenge in and itself and greatly prevents the patients from addressing any one of these alone, let alone their greatly reduced capabilities. So they suffer a low quality of life as a result. In the process of my qualitative research, I developed components of this figure based on the patient's narratives, and I've included some here that I'll go quickly review with you. So, you know, our patients face unexpected poverty. An African American lady, Sharon, spoke about how she was like any other middle class woman until her husband spent all her money. And so our patients may not start off in poverty, but through unexpected turn of events, find themselves in this unfortunate situation with a limited ability to get themselves out. Their poor eye health greatly exacerbates their poverty. So, according to Patricia, she has had vision difficulties for over 5 years. She cannot read from a distance and so has difficulties with driving. Or the poor eye health adds insult to injury, the reduced abilities. Unfortunately, Medi-Cal does not cover prescription eyeglasses, so there's a lack of eye health resources as well as knowledge. So Sharon stated that she tried over-the-counter reading glasses and eye drops. Neither were helpful, and her eyeglasses caused her side effects like headaches. So in the lieu of professional treatment, our patients attempt to help themselves out. They are trying hard to lift themselves out of their poverty, their poor health, and the lack of resources in order to help themselves out. So, but they're all together, these three challenges are just big challenges that prevent them from helping themselves out. And I've seen throughout my time at Suchi Mobile Clinic that there's a racial difference in the quality and quantity of healthcare. We've had plenty of patients. One patient, Spanish-speaking Dominicano, confided how his glaucoma had lain addressed for so long. He raised his concern to multiple providers, and when he saw us, that was the very first time that someone even addressed his poor vision. And he had been at, and by the time he came to see us, he was nearly blind in one eye. And so this really demonstrates how culture and structure are both implicated in producing inequality. We see how social disparities mutually reinforce each other. We had a Black mother young mother, she brought her like 6-month-old son with her. She had poor vision, and that prevented her from working to her fullest ability. And she didn't have enough money to make the transportation for her medical appointments. So that was a cold shower, but there is a shining light. We have been able to make a difference through leveraging community relationships. Our patients are actively seeking to improve their lives. Because we are partnering with service organizations where these patients are trying their best to lift themselves out and become fully contributing citizens. With a renewed vision that our services and care provides, they are greatly benefited and are so happy that they can see better, they can drive, they can work to their fullest ability, they can start to lift themselves out of their poverty much more easily, they can better work with these service organizations in order to do so. So our service organizations like homeless shelters and mental health clinics are really happy to be partnering with us. Because our patients, their clients really benefit. And I think just love spreads all around. So our partner affiliates oftentimes provide us with grants and funding to continue providing free eye health care to disadvantaged communities. We started, as I mentioned before, we started off from recycling plasticware, and now we on our services span the entire globe. And so it's been really, really cool to see how much this building community relationships has spearheaded local relief efforts all around the world. Moreover, our partner affiliates volunteered their time during the clinic or site days. So, often all our services are provided by volunteers. And so it's nice when other folks come by to help us out with taking care of the patients. All in all, I think this has been a really great experience. Our founder's mission was inclusive and service oriented. She really encouraged people to volunteer and contribute in order to give back and learn best how to work with those of different walks of life. And our Buddhist model has really helped us provide compassionate care to all, regardless of their story, their background. And our comprehensive approach has really benefited our patients and renewing their livelihood and addressing racial injustice. It's been a pleasure presenting here with you today. Thank you so much for being part of this presentation. If you have any questions, please feel free to contact me. I have listed 2 of my email addresses here. So thank you so much and be well.